President Trump is finalizing a revised version of his travel ban, temporarily barring people from 7 mainly Muslim countries. This comes at a delicate time for the American medical system. Hospitals have until tomorrow to select their next generation of doctors. They're drawing from a pool that includes more than 1,000 applicants from countries on President Trump's list. Tony Dokoupil is in Springfield, Illinois, with how this could impact patient care. Tony, good morning.
Good morning. The United States is suffering a severe shortage of primary care physicians, with gaps reported in virtually every state. Major healthcare systems like this one at Southern Illinois University had hoped to fill some of those gaps with foreign-born doctors. But with new talk of a travel ban, they now fear that those efforts could fail.
I started getting one text and one email after another, after another, after another, after another.
The moment President Trump signed his temporary travel ban, Dr. Jerry Cruz, dean of the Southern Illinois University School of Medicine, was slammed by messages from panicked colleagues.
It's an atmosphere of what's going to happen next. I think there is some fear. There's fear of detention. There's fear of the ban being extended to other countries.
1 in 4 doctors in the U.S. are foreign-born, including an estimated 15,000 from the 7 countries already included in President Trump's travel ban.
How significant is a shortage at a place like this?
Well, in this county, the shortage of primary care physicians is about half of what's needed.
Dr. Cruz had hoped to help rural and shorthanded places like Morgan County, about 30 miles outside Springfield, Illinois, by recruiting more international graduates.
International medical graduates are a very important part of the American health system.
Dr. Andrew Gurman is president of the American Medical Association.
In many places, the international medical graduate physician is the medical system. So people should be very concerned about this.
Hospitals have until 9 p.m. Wednesday to decide which recent medical school graduates they'd like to bring on as residents. In a normal year, the best candidates would rise to the top. But this year, hospitals also have to weigh whether to take a risk on a candidate whose visa might be denied.
All your dreams are shattered just by an issue of, a piece of paper saying that you can enter the country.
Imad Uddin Hakimi, a Syrian-born cardiology fellow at Chicago's Cook County Hospital, arrived as a resident in 2011.
If someone in the White House happens to be watching this, what would you want them to know about the doctors from these 7 countries?
I would really urge them not to take this opportunity away from them. If the programs wants them and they want the program, they should have the same opportunity to match here.
Dr. Cruz hopes the new ban includes an exception for doctors.
What message would you have for foreign applicants who are watching this play out in the United States and thinking about next year?
I tell them, just hang on, we're there for you.
Now, the average doctor sees between 800 and 1,500 patients a year. So when we're talking about the 15,000 physicians from the 7 countries already affected by President Trump's travel ban, we're talking about health care that could affect millions of Americans. Gayle?
Thank you, Tony. Another perspective to consider for sure. Thanks a lot.